Welcome, everybody. Thank you for coming to this evening's webinar. My name is Holly. I am the Communications Director here at TheraPsil. We're just going to give it a minute or two for people to spill into the Zoom meeting tonight. A couple of housekeeping things. If you do have any questions that come up during the webinar, please put them in the Q&A function, which you should be able to find at the bottom of your screen. It's always nice to let everybody know where you're coming from if you feel comfortable. Often we have people coming from around the globe to these webinars, so that's always exciting just to see how far the reach is. And yeah, so if you don't know what you signed up for tonight, we're going to be talking about psilocybin therapy for substance use disorders. Again, my name's Holly. I'm the Communications Director at TheraPsil. We are a nonprofit patient advocacy group, and we believe in legal medical access to psilocybin therapy. So with that said, I'm just going to get started with a land acknowledgement. So I'm in Toronto. I want to acknowledge that I am conducting this Zoom from Toronto, which is the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, the Wendat peoples, and Toronto is now home to many different First Nations, Inuit, and Métis people. I'd also like to acknowledge that I'm a settler and I am a guest on this land. And psilocybin mushrooms, the substances which we will be talking about in this webinar, some of which grow naturally in Canada, they've been used for thousands of years by various Indigenous communities across the globe. And we'd like to acknowledge at TheraPsil that the modern psychedelic therapy movement, which we advocate for, just would not simply exist without Indigenous knowledge keepers who are the original custodians of this medicine. So I say that with respect and thanks to these Indigenous knowledge keepers. So without further ado, I'm just going to go through a little bit of an agenda. So we're going to have each of our speakers or our panelists introduce themselves today. We're going to talk about what is a substance use disorder to set the scene. One of our panelists, Jon, is going to talk to us about his story. We'll have a discussion with our panelists where I'll ask them some questions. We'll talk about how TheraPsil is supporting patients with substance use disorders. We'll talk about regulations and our public consultation on these regulations, ways to support TheraPsil and the work that we're doing, a little bit about our next webinar. And I'm really hoping we have time for Q&A tonight, so I'm going to do my best to watch the time. And as I said, if you do have any questions, just pop them in the Q&A function, and fingers crossed we'll get to those at the end. And then we'll have some closing statements from our wonderful panelists. So with all that said, could one of our panelists, I'll say, Jon, if you wouldn't mind kicking us off, who are you and why are you here tonight?
Not at all, and thank you, Holly, and you know, the fellow panelists. Honored to be up here with you virtually. I'm from New York right now. I'm in the city, and I was a study participant for NYU's clinical trial treating alcohol use disorder with psilocybin. And up until that point, I had tried everything to stop drinking. Nothing worked, and this virtually took away all my cravings to drink. And that was back in 2015. And it's just remarkable how well this works and how much this is needed. So thank you guys for doing what you're doing.
Awesome. Thanks, Jon. Charlotte, how about you?
Thank you. Thanks for sharing that, Jon. My name is Charlotte Jackson, and I am on the unceded traditional territories of the Coast Salish people here in Vancouver as a settler. And I work as a substance use disorder clinician for our local health authority. So seeing people one-on-one who are struggling with substance use disorders and who are seeking to make change and through various avenues. And I also have been a MAPS phase 3 therapist for the last 5 years, investigating MDMA for MDMA assisted therapy for PTSD. And I'm also a supervisor with MAPS, supporting with the clinical trials in Europe. So that's where I'm located.
Wonderful. Thanks so much for joining us today, Charlotte. Tracy, why don't you go ahead?
Hi, my name is Tracy Justin. I'm a social worker and psychotherapist. I have a private practice in Toronto, which are the traditional lands of the Haudenosaunee, Anishinaabe, Wendat, and Mississauga of the credit along many other nations. And I actively support Indigenous land defense efforts. And I think that accessing psilocybin and legalizing psilocybin is an important act of decolonization and restoration of ensuring that traditional medicines can also be used by the traditional communities whose knowledge we benefit from today. And I'm also have been trained with, I'm currently in the cohort with TheraPsil using psilocybin, and I completed a MAPS training using MDMA as a therapeutic intervention as well.
Awesome. Thanks, Tracy. Thrilled to have you here. And Tara.
Hey all, yeah, my name is Tara Taylor. Like a few of us here, the majority of my work is carried out on the unceded and stolen territories of the Musqueam, Squamish, and Tsleil-Waututh peoples. Most of my work is also done in Vancouver's downtown east side. Been here for about 17-ish years, kind of working across many different disciplines and sectors with a focus on social justice, community well-being, harm reduction, and most recently, the last 5-ish years, as a response to the toxic drug supply hitting our streets within the opiate epidemic. Helping to run Canada's busiest peer-run consumption site, the Overdose Prevention Society. We see around 900 people a day, well, 900 visits a day, does allow me the access and the honor to work alongside a lot of folks active in substance use and substance use disorder, what works for them, what's not working for them. And yeah, just excited to be a part of this panel with everybody here to talk a bit more about that and some of the ways that we can respond to helping people.
Fantastic, Tara. Thank you so much. So as I mentioned at the beginning, we have an awesome panel, and now you know why. So Tara, if you could kind of jump into things for us and let us know, what is a substance use disorder to set the scene?
Yeah, there's the substance use disorder, there's definitely the clinical definition, and then there's also, what breaks off as to the reasons and what leads to maybe the disorder. Let's get on there. So yeah, everyone can read it there. The clinical is, according to the American Psychiatric Association, substance use disorder is a complex condition in which there is uncontrolled use of substance despite harmful consequences, which is a really beautiful package to put it in, nice and tight and pretty. But actually what it is, it misses a lot of what it is, right? And I'm sure a few folks here can speak to it, is what it is it's a resilient response to people living within like ongoing systems of oppression, intergenerational trauma, like you name it, and there's reasons that people are taking substances, right? Like one of the biggest myths, I think, is that if you live with substance use disorder or know someone who does, that there are tons of misconceptions. And one of them is that it's a choice, right? Like it's not necessarily a choice. It's what someone's using to cope. It's how people are coping, and even just naming what is a harmful consequence, right? So like harmful in what way? If they're not using substances, is that no longer harmful that they're living, with what it is that they were taking maybe substances to help blanket with? There's a few other of the myths that, someone needs to hit rock bottom before they're able to access or get help. And why as a society would we possibly think that someone needs to hit rock bottom at the absolute worst before that's when we offer them help, right? Like it's a part of what I do appreciate about the work that I've been able to see within psilocybin therapy is folks don't actually need to get to the worst or have lost absolutely everything before accessing something that's helping to change brain activity and the narrative of what it is to respond to living with substance use disorder. One of the things that I'm witness to is once you give somebody a clinical diagnosis, it then kind of opens the door to continue perpetuate more stigma, right? So maybe what it is someone's using substances to work through something, to numb, to all the thousands of reasons that there are that are all complex. But if somebody's been given a diagnosis that's tied to clinical, that's in the DMV, that's held there, what is the response to that? It's usually pretty black and white. It's either this or this pharmaceutical or that pharmaceutical or this level of care. But what it actually is, it takes the human out of it by adding the clinical model into it a bit more. Another of the big myths that I often come up against is that substance use is only a problem in lower income or socioeconomic layers of society, right? Like definitely, especially with most of my work being in the downtown east side, folks feel substance use disorder mostly just affects that. But like what that actually is, we're just seeing people living within poverty that don't have a door to close, right? So some of my friends and people I know that I'm close to that are living with substance use disorder, they have a home and a door to close. So like you don't get to see what's happening for them, but it still does affect, and it comes out in the numbers that we see within the opioid epidemic is the numbers of folks, the ages and the economic status that we're seeing are generally folks that are not living in the lower income bracket. Holly, I'm not sure if we wanted to show a couple of those slides that just kind of speak to some of those numbers, or if anybody wanted to maybe, add a little bit more to what I'd said or anything in that sense.
Yeah, I just want to say, Tara, thanks for adding that more nuanced definition, because I think once we get into the clinical terrain, we can very easily dehumanize people and objectify them and other them. And
Yeah.
I think that one of the most important parts of supporting each other, because the majority of people use substances. It's really a spectrum, whether it's problematic or not, or who calls it problematic, or what we consider problematic. So I just appreciate your lens there. In let's keep people at the center and keep relationship at the center, because it's the relationship, I think, that heals. So anyway, I just want to jump in and thank you for that.
Thanks. Yeah, and then so go ahead. Sorry.
And oh yeah, I'd also just like to add that, when we look at substance use and why so many drugs have been criminalized, we can't separate that from processes of racism and colonialism, and that the war on drugs has always been about racism and colonialism and the ways that and classism, I would say, and it's an active tool to, it was used as an active tool in colonization to displace Indigenous peoples from their lands, and then it has been actively used as a tool in gentrification to displace racialized communities from their land as well. So not only, we always look at it from an individualistic perspective, a Victorian era perspective of some individuals' moral failing, when it's actually a strategic and political act to displace, dispossess, and to harm communities and to criminalize them, so that more land, more resources can be taken for the project of capitalism and white supremacy.
Yeah.
Awesome, thank you. And I think like when we show maybe the slide of, I think the next one, the crisis, where it kind of shows a bit numbers there. We're currently existing in a place in which there hadn't been so much focus on what is substance use disorder, who it is affecting, what it looks like to be affected. Like you look at the organization Moms Stop the Harm. For those who don't know it, definitely check it out. And it's mostly moms and fathers and family members who've lost someone to the drug poisoning. And so when you're seeing 12 people a day dying, the ripple effect of that is huge, right? So we know that. So like for myself, I get to work in Vancouver's downtown east side, and after decades and decades of radical activism to hold the ideas close and to spotlight what's happening within folks living with substance use disorder, and start giving folks that living with substance use the power to name what's useful for them, what's helpful for them, what kind of treatment or recovery would work, or even what it is to use substances but not in a way that's as harmful, is stuff that right now in the last 4 or 5 years we're seeing a lot more of it coming to focal point, because there is such a high number of what's happening within their deaths. So it's also a lot of years working towards this, where we get to have conversations such as this, or we get to talk about what it looks like to have an exemption so that someone can receive treatment under this. So it's like, as much as it is devastating on a daily basis, I do also see some hope in these kind of conversations, because I see the shift happening with some of this outside the box thinking of ways to respond to people living with the diagnosis of substance use disorder. I feel like maybe, what was that, Holly? No, go ahead.
No, I was going to say thank you.
Yeah, I feel like, I could definitely talk about this for a very long time, but I really love to hear Jon's story. He has a lot to bring to this as well. So yeah, I would love to pass that over. Yeah.
Absolutely. And in the spirit of keeping things person-centered and patient-centered, I would like to pass it off to Jon, as Tara mentioned, to share your personal story, Jon.
Oh, well, thank you. And yeah, this has been very informative so far. So I hope I can add some value here. But basically, I was so desperate and I had tried everything to stop drinking from, 16 years of age. My first AA meeting was at 16 to up until the clinical trial at NYU. And I was lucky enough to get in at 25 years old. So I tried rehab, and willingly, this was, I was, you said that this isn't a choice. I mean, I was trying to stop drinking. I was trying to get sober and I could not do it with all of these methods out there. I mean, it's scary how ineffective these treatments are that are currently available to us. And I was always afraid of psychedelics. I never touched them. I believe all what I learn now are myths about you'd go crazy or, turn into a vegetable. And the doctors at NYU, they assured me that that wasn't the case. And this is actually a safe treatment to do if properly applied and medically supervised. And the screening is a very important part of what the doctors do. And every time I meet a researcher, I'll ask them, have you had any negative outcomes where the study participant leaves the clinical trial worse off than they came in? And I have not heard that yet. And most of these researchers are very modest and they're, they talk about the numbers. They're not snake oil people at all. So, I tried everything. I did 3 psilocybin treatments over the course of a year-long clinical trial. And after the first psilocybin treatment in 2015, I stopped drinking. And I did 2 more psilocybin trials. And before and after, there are psychotherapy sessions. So it's not, you go in, you talk to the 2 therapists there, doctors, and it's basically like a one-on-one psychiatrist, but a 2-on-1 where there are 2 doctors. And then the first part is the preparation prior to the psilocybin session, about a day, I think maybe sometimes even a week before. And then after, usually the following day after the psilocybin session, there's an integration part, which is very important too, and try to get to the bottom of what you learned during those sessions. And I was just so desperate at this time that I said, I tried everything else, nothing worked. And I have nothing to lose here. And I'm happy I took that risk. So this obviously worked so well for me that I've dedicated my life to making this accessible to other people, because too many people are dying. And especially we're in the, I'm sure with Canada too, but the US was in the middle of a terrible mental health crisis with suicides and overdoses. And then you throw on the pandemic on top of that. This was before the pandemic. I mean, it's really scary, but the silver lining is, according to the research, this works. This treatment works for the vast majority of patients going in. To give you a perspective, 60 to 80% success rates from these clinical trials. When I checked into rehab, the director of the rehab told all of us we have a 3% chance at succeeding. And he said 97% of you are going to relapse, end up dead, or have to come in 7 more times on average. So that's the reality of what this is. So the good news is, if this gets passed, it will save a lot of lives. And I'm not a unique story anymore. So thank you for that.
Thank you so much, Jon, for sharing your story. It's I know you were on 60 Minutes where if somebody's saying, where do I know this guy from? He was interviewed by Anderson Cooper on 60 Minutes, and that's where you may know Jon from. Thank you so much for sharing your story. Does anybody have anything to ask Jon from our panelists? Anything extra you want to know? If not, I can jump into discussion.
Yeah, I just want to say I really appreciate you sharing. It's so powerful to hear from someone who's had a direct experience, and I think that makes it very relatable and compelling. So thank you for that.
Well, thank you. I mean, the work you're doing with MAPS is really saving lives. So if it weren't for folks like yourself, people like myself would not be lucky enough to still be here. So thank you.
Thank you. Well, this, my first kind of discussion question, which is for everybody on the panel here, touches on some of the things that Jon was talking about, which is, what are the current treatment options for substance use disorders? I know, Jon, you mentioned rehab. I think Tara, you mentioned prescription medication. I'm sure it also varies based on what substance use disorder an individual may suffer with. So broad strokes, what are the treatment options? For whoever would like to start.
I mean, there are shots like Vivitrol. For drinking, I took Antabuse. I think opioid use disorder, folks can take Vivitrol as well to curb their cravings, similar to alcoholism. But yeah, just basically a lot of support groups out there too. But you guys probably know more about this.
Tracy, do you want to give it a go?
Yeah, so many of treatment options like, pharmaceutical-based interventions or medical models of treatment, the field is largely unregulated, and so there are a lot of inconsistent ways. Many will try to claim evidence-based practices, and many come from more moralistic or religious-based models with adaptations made, so like NA or AA. So many of the models are inconsistent, and few focus on trauma or looking at different ways of, there can be things like CBT or DBT integrated with a trauma-informed, but not necessarily trauma-focused lens. So there's a wide variety of different options, but mixed results in terms of efficacy.
Yeah, and to add to that, sorry, go ahead, Charlotte.
No, carry on.
Just kind of add a bit to what Tracy was saying. And my experience in Vancouver is just a really old, like punitive system, right? Like if you want to go into treatment, you have to jump through a whole bunch of different, hoops. And then once you get there, you're not allowed your dog, you're not allowed your partner, you're not allowed cigarettes, you're not allowed. So it's like almost like replicating another form of institutionalization, whether that be within, mental health or within like the criminal justice system. And so it's not really set up, in my experience, set up in ways to set up for people for success or meeting people where they're at to build their own path to recovery or treatment or what's going to work for them. Even as much as you're only allowed to access it a certain amount of times a year, right? And if you hit that max, sorry, you got to wait till next year. And when you have 12 people a day dying like that, it's not enough. It's not okay.
Yeah, thanks for that, Tara. And I would add that, I just a few weeks ago, we were trying to get somebody into detox, a medical detox, and we understood that there might have been 100 people in line ahead of our client. So let's just name that this whole field is radically underfunded. This is probably one of the last healthcare, I shouldn't say that because I'm sure there's others that I'm just not personally aware of that has been neglected, in terms of research, in terms of funding, in terms of innovation. So there is no treatment on demand. You have to call every single day to get into, or you have to call every week, or you have to call every month. And if you're struggling to just kind of manage your day-to-day living situation and get enough supply to keep yourself stable and out of withdrawal, then those asks are essentially there to eliminate or to create barriers to service. So yeah, there's, here in Vancouver, we have one-on-one counseling, if you can find it and get into it. There's group counseling, which has all moved online because of COVID, which doesn't work for a lot of people because not everybody wants to be on a screen. It's very intimidating or stressful. We've got, like Tracy said, a highly unregulated market where people can kind of just have a pop-up shop that they're opening a treatment facility, but there's no regulations, there's very little oversight. It's hard to know what they're offering. Then we have more residential treatment. And I've certainly supported lots of people through many, many iterations and ins and outs. And, you know, sometimes maybe it does take so many times, like Jon said, you know, sometimes it takes a number of times. That's okay. But there has to be access to it for people to have, you know, the opportunity to get well. So that's sort of what I know. And then, of course, why we're all here is because we want to bring the innovation of psilocybin and other psychedelic, you know, medicines or non-ordinary states of consciousness access to help people who aren't supported and aren't succeeding or healing in the conventional treatments that are available right now.
Great, thank you. That was very insightful. I definitely learned a little bit. Knowing that these treatment options, some of them aren't working for some people, and psilocybin therapy could offer, you know, a good treatment option for individuals. How could we make that a reality, and how does it actually work? Like how, and maybe Jon, you could give some insights into this. How did you go from an alcohol use disorder to just not drinking after one psilocybin session?
I mean, I was shocked, and it wasn't, you know, it's not like right after I was like, okay, this is, like all the cravings completely went away. But after the first sessions, or after the very first session, it didn't, the cravings weren't, you know, enough for me to act on them. And that's a big thing, you know, especially as an addict or someone suffering from substance use disorder. That's huge if you're not going to act on your cravings and impulses. And then after the second one, they upped the milligrams a little on the psilocybin, and it was much more powerful and much more rewarding, the session itself. And that's what I learned. So I was always afraid of a bad trip. And I don't, you know, maybe Charlotte's seen this too, and some of her study participants, but I was always afraid of a bad trip. And the doctors actually, they said, you know, a lot of times the bad trips are those are the experiences that you need to confront and get rid of that trauma, or at least see the trauma head on and see it through. And you're better off seeing it through the other end. So the bad trips are actually the most rewarding, which was very interesting to me. And so how this worked was basically, it gave me, for me, my alcoholism was subjective, meaning I always made excuses for my drinking. I always said I'm young enough to, you know, I can clean up my act down the road 10 years from now. But when I did the psilocybin therapy, it gave me an objective view of my disease and the people around me who I loved that I was actually hurting. I wasn't really hurting myself because I was numb to it all and I was drunk through it all. I was hurting my loved ones that were watching this with sober eyes. And that was the realization I had from psilocybin assisted therapy.
Thanks for that, Jon. And I think I would just add, you know, bad trips. I mean, bad has a particular connotation. I think there's difficult trips. And I think when you have like somebody there that's really qualified and trained, and, you know, even two people, I mean, it's about the safest condition you could find to have a difficult experience with, because there's people actually with you, which is often a corrective experience, because often people have had trauma, precisely it kind of gets settled into the nervous system as trauma because there wasn't anybody to accompany them and to help them understand and process it. So there's a corrective experience, and having people, you know, supporting and guiding you, that is sort of a counterbalance to early, you know, things that drive the cravings.
Thank you for that, both of you. So I know we talk a lot about regulations at TheraPsil and making this, you know, an accessible treatment option through, you know, consultation with a healthcare provider for folks with a substance use disorder. Is that a workable model? Can this help individuals through that model?
Are you talking about the current model of like singularly
Oh,
apply
no.
for exemptions, or just the
No,
fact?
we know exemptions are not sustainable. Like if
Okay.
this was legalized for medical purposes, how big of an impact do you think that would have on folks with substance use disorders being able to treatment this potentially life-changing radical option?
Well, I'll just throw in my 2 cents, and then I want other folks to, but it's already working because people already are using it. Let's just be straight and honest and upfront. People who have access are accessing it, and it's working. It's just that we're talking about equitable access and legal access and decriminalizing access. So we already know it works because it's working. And it's just how many people can we have safely access this in a legal context? That would be my point.
Thank you. Tracy or Tara, do you have anything to add to that?
Yeah, I think there's a lot of really interesting work being done through MAPS' protocol, also through TheraPsil, but also looking at what is the integration work that happens after a session. So I think if we have a decriminalized access to psilocybin, I think it allows for a safer pathway for for equitable access. As Charlotte is saying, we know that racialized communities are criminalized with harsher penalties and actually more charges. So for a lot of communities with complex trauma related to colonialism, related to experiences of marginalization, it makes it a lot more accessible and safer for folks who don't have that class, economic, or other forms of privilege that keep them safe.
Yeah, and I think just a short thing to add, just like echoing the same thing is, having the access, that the whole decrim of it all would have a big and lasting impact, right? And within the downtown east side, there is a somewhat underground psilocybin society that's existing, in which folks are supporting each other to access to it, and also supporting each other through it. And it's like I'm seeing people who used to not be able to get out of the alley, and for an entire day they were just stuck there, trying to do what they needed to do to be able to exist in that day, who are now working 3-4 days a week, 5-6 hours a day, and they tie it directly to that, like that was something that changed it for them, right? And that's a way that this community did it. It wasn't anything where we had people such as the Charlottes and the Tracys and others leading people through that. That's just using the medicines, and also to name centuries before any of these conversations, we have, the original folks of the land were using a lot of medicines such as for things, and so we know that it's working, and we just need it to be accessible for, like, again, for everybody, and we know the answer to that.
Thank you. A bit of a leading question, I suppose. One of the comments that we actually get a lot on Facebook, because there is so much misinformation about substance use disorders and psilocybin, is psilocybin addictive? And I think there might be this myth that individuals with a substance use disorder who are then accessing psilocybin therapy are really just swapping one substance for another. Can somebody speak on that? And is that true? Is psilocybin addictive? Is there research on that?
My personal experience, no, it is not addictive. And I would not want to go back and do it again. Trust me, I'm grateful I did do it, but at least right now, 6 years later, I have no desire to go through that again. I think, it did what it needed to do, plus some for me. And no, it's not addictive. And, I was on another panel with a doctor from Yale, and she said the actual mushrooms themselves, now in the clinical trial, they used, synthesized psilocybin, 25 milligrams. So it's very precise. But if you were to eat actual psilocybin mushrooms, you couldn't eat enough to overdose. And you could overdose on things like Tylenol and over-the-counter meds. So that was interesting to learn. And that was, about a year ago that I was on that panel, and I didn't know that. So you can't overdose on that, and it's not addictive. So, and that, here in the States, the FDA granted this breakthrough therapy designation, And the main, the two things they're looking for are if it's safe. I mean, it could be a great treatment, but if it kills half its patients, they're not going to, make it legal. So they found out it's safe and they see that it works. So they granted that breakthrough therapy designation. So if properly done, this is extremely safe to do, not addictive.
Thanks, John. And I can just echo from the MAPS research that we have not found people going on to develop addictions or problematic use with MDMA. I think much like what you're saying, when you're using it in these contexts for healing and you're doing really the deep psychological consciousness work, it's not, I mean, and I'm not saying that substances don't feel good and aren't fun, and I'm all for that too. Like, let's be clear, that there's a lot of pleasure that can be had from substances, but used in these contexts, it's the deep work, and that's not, and it's not that it can't be pleasurable, but just to add to your point that used in this way, it's not something that people necessarily want to do again and again and again.
Thank you. Is there any other misconceptions or myths about substance use disorder or psilocybin therapy that you often hear that you would just like to set the record straight on? It's okay if there isn't.
I was just me going in, I was terrified of the dangers of it. But once I learned that this was actually safe to do if you're medically and mentally fit to do so, and then you should be fine. You might have some challenging, experiences during that session, but nothing, no negative, permanent negative outcomes. So that's, and I thought I would lose a lot of motivation too, and kind of just be, right, like your stereotypical psychedelic user. But that's again, a lot of propaganda behind that you're just not, kind of like a hippie that has no drive, and that's not the case at all. So those were my two concerns.
I think a thing that I hear a lot about using the classical psychedelics is a fear of going crazy, or a fear of losing your mind, or a fear of going somewhere and not coming back. And I think that's so common as to be, clinically relevant. And I personally would be curious about what experiences people have had in their history where they did feel like they had lost their mind, or that they were derealized given their traumatic environments or their unsafe environments. So it could very well be that they've already had that experience and they're afraid of having it again. That's just a speculation, but that's certainly something that comes up. And I, again, think that the set and the setting and the container and the preparation and the integration are all things that mitigate those kinds of, risks or outcomes. And we certainly haven't seen them in the research I've been part of.
That's great. Thank you. Tracy or Tara, any specific thoughts on that? Anything to add? Nope. Okay. John, we actually had a question that kind of follows what you were just speaking about. So was there anything else you can add about what made you become comfortable enough to pursue psychedelics as a treatment option? Or was it more of a process that you went through where you just reached a point where this was the only option for you?
So both. The reason I explored this was I had already exercised all my other options. I mean, every single thing that's available out there, I tried it, and more than once, unsuccessfully. So that's the only reason I even entertained this, and I was still uncomfortable. So once I started talking to the doctors, I realized, I mean, these are medical doctors, PhDs from New York University. I mean, some of the best in the world. And they just showed me the data. They they spoke to me on the facts and the research. And I was just thinking, how the hell is this not available? I mean, how many of my friends had to die already because they could not access this? And I mean, it was a little infuriating too. But basically once I spoke with the doctors, I was more comfortable doing this.
Thank you. I'm just watching the time. Charlotte, I'm wondering if you can now talk a little bit about the work that we're doing to support individuals with substance use disorder in accessing psilocybin therapy. What are maybe the barriers? Anything you'd like to share?
Sure. Well, TheraPsil, as I understand it, has been really, like, a lot of people with substance use issues have reached out to TheraPsil, really seeking to have access and to have exemptions for their own treatment. So it's certainly, the need is there, and the desire is there. So there is a group of us within, or as an adjunct to TheraPsil, who have put an exemption in for one individual so far who has pretty severe opiate use disorder. And this is an individual who also just, on their own has accessed psilocybin and has found benefit to it in terms of, I don't know what the mechanisms are, but at least decreased drive to use, maybe more time between using, maybe using less. So definitely changing the profile of their using. And I think that's what we're looking for, is sort of this opportunity to support more people to have access in this safe way, because right now what's happening is people have to basically break the law to access this medicine. So it's just criminalizing people that are already criminalized. So this is what we've done so far as our first pilot is applying for one section 56 exemption. I don't believe we've heard back from the minister. So we are waiting, but we're in this fraught position of wanting to act because the risk of the poison supply is so dangerous that we're in a moral dilemma, because is it more ethical to break the law and offer this to somebody as a harm reduction intervention than waiting for an exemption and then being able to treat them? So this is the conundrum. So yes, this is absolutely an area of interest for TheraPsil to start giving more equitable access to people who are seeking this out, and maybe like Jon, who've tried everything and haven't had the change they've wanted.
Thank you, Charlotte. Yeah, it's a perfect segue to talk just a little bit about the regulations that we are trying to enact, or bring to Health Canada and say, somebody shouldn't have to go underground to access this. They should have access to GMP certified mushrooms. They should be able to grow their own mushrooms. They shouldn't be criminalized for accessing psilocybin mushrooms. Therapists shouldn't be criminalized for supporting patients in this treatment option. Really, this should be something that you go to your physician or healthcare provider, and it's discussed among the menu of other treatment options for substance use disorder, or palliative care, what have you. So we put together regulations. They are draft one of the APMPR, which we're calling the Access to Psilocybin for Medical Purposes regulations. And we put those forward to Health Canada. We put them forward to Minister Haidu, who's the current federal health minister. That may or may not change in 6 days. We do not know. And we've actually opened up a public consultation period as well. So we're inviting any and all stakeholders, anybody on this call, anybody in the community, to give us your feedback on these regulations. It's really important that everybody's voice is heard in the creation of this. And I actually think that's kind of a once in a lifetime opportunity to give feedback on regulations that will hopefully be enacted. So over the next 3 months, TheraPsil is working really, really hard to demand these regulations be put in place. Folks in palliative care cannot wait for exemptions. Folks with substance use disorders cannot wait for exemptions. Folks with other sort of conditions and indications also cannot wait for exemptions. We know these exemptions, they're a great step to open the door. They've helped 38 people get access so far, but this is not a sustainable model for healthcare. I can't imagine, you know, if any other treatment option was treated like these exemptions, accessing chemotherapy through this, or accessing even methadone, for example, through an exemption that you had to wait months for, you know, bring down from the health minister, it wouldn't be acceptable. So please give us your thoughts on these regulations. You can find them on our website. You can email me after. We've had a lot of great questions come through, and yay, we have saved enough time for them. So let me just open up that chat box. Give me 1 second here. The first question that came through, and this is again for all of the panelists, are, you know, what are your thoughts on intergenerational trauma that leads to substance abuse, i.e. residential schools? Who would like to speak on that?
I can speak to that. I think there's an interesting lens put forward by Adam O'Brien, who's been doing some work with MAPS, I believe, or is an approved therapist with MAPS, and is an EMDR practitioner. And then one of the lenses they've been taking is saying that, you know, substance abuse, and this is a common perspective, that substance use is an adaptive response to trauma. And because it's an adaptive response, they're also looking at this linkage of, you know, it's also a way of kind of dissociating it a little bit from the harms that people have experienced. So it makes sense that, and you know, something like residential schools, I just want to say that the trauma hasn't ended. You know, Indigenous communities are being displaced, more and more land is being taken away as we see pipelines going through communities. So communities, you know, aren't free of trauma either. So trauma is constantly being reenacted onto communities. And so to cope with this ongoing onslaught of violence and terror, it's an adaptive response to not have to feel the intensity of all of the harm you're experiencing.
Thank you. Does anybody have anything you'd like to add?
I think that pretty much, yeah, sums it up with it could be a whole panel itself, right? It could be like an entire day of it. But yeah, thank you, Tracy. That was beautiful.
Absolutely, and that's an idea for maybe another webinar in the near future. So thank you for that question and your great start of an answer. One of the questions here is to Charlotte, or whoever has experience in treatment with psilocybin. People who use substances at times develop psychosis from chronic or acute substance use. A, can people use substances while engaging in psilocybin treatment? And B, is psychosis or history of psychosis a concern for people to qualify to receive treatment with psilocybin?
So there's a lot there. I might miss some of the components, but I can say that it's a very interesting question. I think treating somebody who's in an active episode of psychosis, of derealization or non-consensual reality, I don't know that that would be a great idea, because the risk of traumatizing somebody further without there being a container, I don't think would be clinically sound. But there's a really interesting question about, should we be excluding people with psychotic disorders from accessing these medicines? And I think in clinical trials, people have been, because there's an abundance of caution. People want to be we want good results. So we want to eliminate, controllable risks. But should people with psychosis or psychotic disorders be excluded from these medicines? I don't believe they should. I think with the right container and the right support and the right context, that we should not be gatekeepers for people having these potentially healing and numinous experiences. So that was the second part of the question. I don't know if I caught the first part, or if somebody else wants to answer the first part.
Sorry, the first part was, can people use substances still while also engaging in psilocybin assisted psychotherapy treatment? And I will kind of back this up with saying a lot of the times when the individuals in palliative care who are accessing psilocybin therapy, they need to wean off a lot of their medications. Does that also need to happen with folks with substance use disorder? Or is it a harm reduction situation where, you know, what are the benefits, what are the costs?
Yeah, good question. I think, again, in clinical trials, there's the most sort of controlled conditions possible to mitigate risk. Yeah, I think it would be an individual one-to-one, you know, question. Like, you certainly wouldn't want medications or substances that were contraindicated for some reason, like for serotonergic syndromes or things like that. But yeah, and I wouldn't want people to come off their opiate replacement therapy to have this. Like, I think it needs to be potentially medically supported and parsed through. But I can't see why it's not across the board that people can't or shouldn't. It's just whether it's a contraindication for safety.
Great, thanks, Charlotte. And I know in our training program, there's a module about, you know, psychopharmacology and seeing, you know, which medications or substances can be used in combination with psilocybin safely. So there's definitely a lot of information out there about it, and it is taken on a case-by-case basis per patient. So this is a question for Jon. Jon, are there any characteristics or outcomes of the psychedelic assisted therapy you experienced that are similar to those of other treatments you've received?
That's an interesting question, because the answer is yes. And, you know, I tried AA, as I mentioned earlier, and Bill W. was one of the founders of AA. And he actually tried to introduce LSD into the step work. So AA has 12 steps, and you complete the steps, and, you know, you're on a better path. And he tried to introduce LSD. So he took a psychedelic back in the 50s, I think, and he really credits that with his sobriety as well. And he just saw the potential, the therapeutic potential of all of this. And so there are a lot of similarities between this treatment, the psilocybin treatment, and AA, such as a higher power. In AA, they want you to surrender to alcohol and surrender to a higher power. And it doesn't necessarily have to be God, but in Michael Pollan's book, he talks about a study participant who was an atheist before and after the psilocybin session, but during one of the psilocybin sessions, that atheist saw God. And so it's that of the higher power. And also another similarity between this and AA and other NA, other support groups, is a sense of community. Folks that, you know, it's almost like being an astronaut or something, or being a part of this small club that no one really knows what those experiences are, and you can't really relate, and you can't, they're ineffable, you can't explain them and put them into words. But if you see someone else who has also experienced that, you know, you have a bond over that. So the community aspect and the higher power.
Great, complicated question. Nice way to
Great
answer
question.
it.
Yeah, no,
Yeah.
Great.
It was great. One more for Jon, and then we're going to wrap up question time. This one is asking you, can you go into, you know, the first night with psilocybin therapy a little bit more specifically? What did that experience look like? Eye shades, music, set the scene.
Yeah, exactly. So I went in during the day. The doctors said don't drink or do any substances, I think 11 days prior to my first session. And so I marked that down in my calendar that was going to be my last night of drinking. And it was on my sister's birthday, and I didn't care. I just drank alone, thinking that this could be the last time I do drink. So 11 days later, I walked in the morning. The doctors drug test you, make sure there's nothing else in your system. They do some sort of screening as well, make sure that you're mentally prepared for this, and if you're in a good headspace to do this. And a very important part is they had the pill. They handed me the pill and they said, state your intention. What do you want to get out of this? And I knew I was there for my drinking, but I knew it was bigger than that. So my intention was, I just want to find an inner peace and calm down. And I think after that happens, I'm not going to need a drink. And I was right. It did work. And so they give you the pill, psilocybin. It's about 30-40 minutes before it kicks in. So they gave me an eye mask, something you'd get on an overnight flight, and they gave me a set of headphones and mainly played classical music, indigenous music, and really to kind of steer you, which the music really helped with all of this. And I thought it would be more like a 3D movie, but it wasn't. But I did, a powerful thing is I saw a liquor bottle in the middle of the desert, and then all of a sudden it disintegrated into the sand. And I thought that was pretty strong symbolism for my alcoholism leaving me. So it was stuff like that, almost cliche, but really to the point and in your face. And it was just sense of reassuring and, everything's going to be fine. So it was really, it's not all scary, like Charlotte said. I might have said that, I was talking about the bad stuff, but there are some good parts in it. And you feel, euphoric and there are highs and lows, and it really amplifies your emotions, which I found very interesting. So it was a roller coaster in that sense.
Great. Thank you so much for sharing those details, Jon. It's incredibly powerful imagery. And we've heard similar things from other individuals. Another individual, Lori, said she's suffering with terminal cancer. She said she saw her cancer in a box and separate from her body. So it's always incredible to hear, what you're actually seeing and feeling during those sessions. So thank you so much. I am acutely aware of the time, so I'm just going to share my screen, talk a little bit about what you can do to support the cause to legalize therapeutic psilocybin in Canada, which is basically, number one, you can donate. We're a small nonprofit. We have 5 full-time team members. We have 3 contractors and several more other wonderful folk. We have financial outputs, and we can't do this work without your support. We really appreciate any donations. Our fundraiser closes in 32 hours. All donations are matched. So if you donate $50, it's a $100 impact. If you also donate $50, you get a free 4-ounce bottle of Dr. Bronner's Heal Soul Soap, which is a limited edition Dr. Bronner soap, and it has information about psychedelics on the bottle, which is pretty nifty. So Adam's going to pop our fundraiser in the chat here. We also have a couple other campaigns going on, so you can email your candidates, your local MP candidates, ask them what their thoughts on psilocybin therapy are. You get to vote them in to represent you in Parliament. So if psilocybin therapy, mental health treatment options are important to you, it'd be great if you knew, what their stance on this. Will they support and advocate for this in Parliament? And we've got a survey on our website that you can email them with. We'd also love your feedback on the regulations we've proposed. Again, those are on our website. And if you have any issues finding those, just email me, holly@TheraPsil.ca. And I am just, one last thing. We do have a bonus webinar happening on Monday. So out of our regular weekly Wednesday cadence. Very exciting webinar. It is featuring Dr. Robin Carhart-Harris. He will be talking about his recent study looking at psilocybin for depression. So definitely not one to miss. And if you have registered for this webinar, you're already registered for that one. So just show up on Monday. That's at 4 p.m. PST, 7 p.m. Toronto time EST. And I would love to thank all the panelists today. Thank you so much for your time, your energy, your knowledge, your work in the community, your advocacy. And I'll pass it off to you for any closing thoughts, any final calls to action, anything that's on your heart. Charlotte, why don't you go ahead?
just an honor to be on the panel with you all, and really, Jon, to hear your personal experience, just really, really moved and just very humbled to be here with you all. And if you're in Canada, there is a federal election on Monday, and if you haven't voted, please vote. I'm still an optimist about voting helping, so that's my plug for that.
Thank you, Tara.
Yeah, absolute honor to listen to everyone and talk with everybody here. Jon, thank you for sharing. Definitely powerful to have voice at this. Yeah, I don't know. I can just anything I can urge anybody listening to today to do to make this more accessible. Holly went over it all. I'm losing community members, family, friends, coworkers on a daily basis. It's dire. We need other things out there. We need other forms of treatment and recovery that do work, and we know this works. So yeah, please use your voice and make a call to make it happen.
Yeah,
Awesome.
Thank you, everyone. Such an honor to be on this panel with everyone. And Jon, I echo, it's such an honor to for you to share your personal experience. So thank you. And yeah, really just wanting for folks, using whatever mechanisms, if it's voting, if it's having, connecting with local harm reduction spaces in your community, and really just transforming the conversation. A lot of resistance throughout the ages has been, just stigmatizing folks and even accessing treatment services. So having conversations with your community members and just reducing the stigma and really understanding substance use is not a moral failure. It's not an individualistic problem. It is structural, and just broadening those conversations. So thank you all.
Thank you. And Jon, take it away.
Yeah, I just want, stories like mine would not be possible without the fellow panelists here and the work that you guys are doing in TheraPsil. I mean, so it's truly saving lives. Mine was one of them, and I'm very lucky. So if you can donate, spread the word, get the message out there. This is saving lives. Times are very bad right now, but the silver lining, and stay optimistic, because this treatment works for a lot of people, and it will save a lot of lives. And if anyone has any questions about being a clinical participant, I'm pretty easy to find online, Jon, Jon at apollopac.org. Email me. Happy to help any way I can.
Awesome. Thank you. I just popped your email in the chat there, Jon. Thank you, everyone. I really appreciate your perspectives, and have an excellent evening. We'll talk to you all soon. Oh, and thanks to everybody who came tonight as well for listening. We wouldn't do these webinars if you didn't show up, so thank you.